right, I think we can begin and let everyone else sort of join in as it goes. So hello and welcome everyone. Thank you for signing up for today's installment of the ComCare eLearning webinar series. We're super excited to have you here with us today. And today we're going to be talking to you about how you can adapt your existing application to fit a COVID-19 world. Just want to take a quick moment to introduce our speakers and our in-house ComCare experts for today. We have Erin Quinn. Most of you may know her already. She's the Director of Customer Success at the Magi. She works one-on-one with our new, existing, old customers and to help them get onboarded onto ComCare. We also have Jordan Lerner today, who is a project manager based in Cape Town, South Africa. Jordan's played roles on the customer success team as well as the global services team at the Magi and worked across multiple implementation projects. And he's also most recently been managing the Magi's COVID-19 response in lower middle income countries. So without further ado, let's just get into the agenda for the day. So broadly, we're going to be talking about the background of COVID-19 adaptations and what are some things you need to consider before you start making these tweaks to your applications. And we're going to run you through some use cases and examples of these adaptations. And of course, the Magi's template applications. And we have a home-based care template app, which we'd like to showcase. And throughout the webinar, I would encourage you to use the Q&A box in Zoom to put in your questions. We'll slot in some time towards the end to take them up, but I will also try to answer them on the go. So over to you, Jordan and Erin.
Thanks, Avni. And thank you guys all for joining us here. I know that in the COVID world where most of us are remotely working every single day, the last thing you want to do sometimes is join another webinar, but we appreciate you guys being here. And like I said, or like Avni said, we really hope that the examples that we present today will resonate with you guys and, will help you guys adapting your applications for kind of the long haul. So why now? We kind of have this slide every single time we do a webinar. Why are we still talking about COVID? Why are we talking about this in this exact moment? This webinar was actually inspired by a lot of customers that I have been working with over the last 3 or 4 months. We know that programming during COVID-19 is unpredictable and it's ever changing. We know that countries are going to close and reopen and close and reopen, and we can't just count on the fact that once a country reopens, we can go back to business as usual. And so because of that, we know that our apps have to be flexible and they need to collect data and deliver services in any sort of situation. And so this includes things like in-person versus remote. So it's very fair to think that your country may close, reopen, and you need to keep your service delivery consistent throughout. Similarly, we've gotten a lot of questions from folks about using ComCare to make sure that it's safe for their workers to either go back into the office or for their workers to go out into the field doing things like going to clinics or doing home visits. And lastly, we do know that there's a subset of you all who are doing public health sort of work and who are now delivering COVID-19 services, and you want to make sure that you are doing that in a safe way as well. And so the 4 examples that we're going to show with you today, like I said, are really kind of ripped from the headlines of our customers, and they've all been inspired by very real use cases that we've seen coming about. And we anticipate that you all would, encounter a lot of these as well. And of course, we're all hoping for the pandemic for a vaccine to come out as quickly as possible, but we know that realistically, it's going to be probably at least a year before that would actually get widely distributed enough to make us feel better about, taking away these precautions. So really what we're focusing on today is, we had this panicky time in the spring and we did all these closures, we did all these drastic changes. Now it's really building your stable application to take you through the end of the pandemic. And what does that need to look like? So our very first use case is in-person and remote. So as I was talking about, we've seen a lot of countries close and reopen, and I'm saying countries, but it could be countries, cities, states, provinces, districts, whatever sort of government body is determining when you close and reopen. And of course, as case counts go up and down, you're going to close and reopen. And so I think a lot of us thought when we first shut down, once we reopened, we'd stay open, and that's just not been the case. So that's the situation. The solution is now that your application needs to collect similar information in the same form, customized based on whether it's an in-person or remote visit. So whatever service you're delivering, we need to be able to collect that data, whether or not it was virtual or in person. So there's a lot of different questions for you to consider when you're doing this. The first is, what's your primary data source? Are you guys using form exports or case exports, or some combination of both? That's probably the key question you need to think about, because when you make these changes, you need to make sure that you're preserving the integrity of your data, and that whatever changes you make now, your data will stay consistent to what you've already got in the system and will stay consistent going forward. If you're using form data, if that's your primary data source, if you're using it at all, you're going to want to do two things. One, of course, you're going to need to stay in the same form. So, we'll go over in case exports, you could potentially create a new form for remote work and keep your existing form for in-person. If you're using form exports, you can't do that. You need to make all of these changes in the existing form that you have. And super importantly, remember that all of the columns of your form export are going to take the question ID of the question of that data point, whether it's a question or a hidden value. And so you need to keep all of the question IDs the same. And I'll show you what that means. It can be quite complex if you want to collect two different data, like two different questions or two different data pieces for the in-person versus remote, but you can create things to make sure that you're preserving the integrity of that form data export. If you're using case data, you have a little bit more flexibility. You could consider building an entirely new form. So say I have a home visit form, that's my normal home visit form that assumes I'm going in person. If I'm only using case data, I could build a second form being like a remote home visit or like a phone screening home visit sort of form. And as long as I keep those case property names the same, then I could do that. So again, case data gives you a little more flexibility. You don't necessarily have to do all the tweaking within the same form. But again, we're not looking to massively change your data collection process. We're looking to fit whatever changes we're doing into how you already are using your data. Next, you need to think about, well, certain questions need to be hidden. So if I'm doing something remotely versus in person, is there something that doesn't make sense for me to ask? For example, if it's maybe a prenatal or an antenatal form, maybe do you collect some observational data about, about how the woman looks, or maybe do like a take fundal height or some measurement like that. For growth monitoring, we could be talking about MEWAC or weight. Obviously, those are not indicators that you're going to be able to get if you're not in person. So you may need to hide things like that. Similarly, there might be some data collection that you just don't trust to be done remotely. So, if it is something like weight is ostensibly something you could ask people if they have a scale in their house, but maybe you think, I don't know the quality of their scale. I don't know how I feel about them self-measuring. Let's just not collect this. Next, will certain questions need to be added? Is there anything that needs to be considered because this is a remote visit? Are there different data points we need to be adding? Certainly things like remote visits because they haven't been seen. Anything that you think is relevant only for remote visits, you'll want to add. Then you want to think about how the data is going to be reported. Are they still going to use the mobile app, or are they going to collect data in some other way and then input it into the application? I have seen a lot of people kind of going, I don't want to say back to basics, but back to maybe some paper data collection or some sort of more menial, more kind of simple initial data collection, and then that all gets sent to someone. So, you know, that's something to think about too. Are we going to be doing this directly in the app, or do we have this middle data collection source? It's obviously preferable if we can keep it all in the app, but that just might not be an option all the time. So now this is the example I'm going to run through with you guys. We do want to show you guys a lot of this stuff in CommCare. So this is adding remote trainings. Your project conducts in-person trainings with youth on various subjects. And when the pandemic began, your country shut down, training stopped. Since then, you've reopened, you began trainings in person again, and now you've closed again and started remote trainings. And so at this point, you know that you really need to be able to collect things for both in-person or remote sessions. So that's what we're going to try to do. And the data source that we use is primarily form exports. So I'm going to take us in here. This is a youth skills and training application that I have. And this is the form that we're in. So just to show you guys a little bit of it, it asks us some questions like the date and the time, the topic, age group, names of trainers. Really importantly, we take attendance here. And so this pulls from all the cases that have been registered. And then we've got, you know, a few questions about training components and the quality of some of those. We take a photo, we record GPS. So it's a relatively simple form, but it does record some really important things about training. The very first thing that we're going to want to do up top is establish whether or not this is an in-person or remote training. So I'm going to add one question. This training took place. And we're going to say in person or remote. This question is, of course, really important. We're going to use this in a lot of our display conditions. So next, what we're going to do is we're going to go through and we're going to hide some of the questions that we don't think are appropriate if you're doing a remote training. So the first thing, these all look fine. The first one is the quality of small group discussion. We don't think that, we know that small group discussions are not going to happen. And we also know that simulations will not happen in these remote trainings. So we're definitely going to hide this. So I'll create a display condition really quickly. So we're going to say that this has to be equal to in person. So we said that small group breakouts and simulations will both not happen. So let's put this display condition also on the simulation one. And then down here, you can also see that we asked them to take a photo and record the GPS. The photo in a lot of training applications is used as kind of a data quality check. So if you say that 30 people attended, you've got a picture that has 30 people in it. Obviously, we're not, I mean, you could take a picture of like your Zoom call or whatever, but we're not going to do that. And then record the GPS. Again, that's going to be my house or wherever the trainer is. So we're not going to want that. So now we've hidden all the ones that we think are not relevant if you have selected remote. Then one thing that I do want to add is I do think that, you know, I anticipate that my attendees might have some problems with internet. And so I do, in addition to asking who attended, I also want to ask who might have had internet issues that might need follow-up. So I'm going to copy and paste this question. Now, instead of calling it attendees, I'm going to call it needs follow-up internet. And we'll write, did anyone have internet issues that you believe needs follow-up? And maybe, you know, based off of this data point, the trainer or someone else can call these people, can follow up with them later, can just make sure that these people are followed up with. And again, we want to put this only if you are remote. If you're in person, we assume you don't have internet issues. So we're going to throw that display condition on. So now I've taken care of all the things that I think I need to hide or not. The only thing that I want to do is, remember I said that our training components are going to be different. So if you're in person, you can have any of these 4. If you're remote, you can only have a lecture or skills demonstration. So we're actually going to need to create 2 different questions to capture this, one for in-person and one for remote. But then we're going to want to coalesce that, because we want to just have one data point that shows you kind of the final answer, regardless of whether you were in person or remote. Now, a couple really important things. Remember that we use form exports as our data source. And so training components, which is the question ID of this is what all of our data up until now, that's the column that it would have been collected in. And so we still need a question ID called training components that has our final answer in it. That's really, really important for us to remember. So what I'm going to do is I'm just going to copy that for a second. I'm going to change this to say training components in person. I'm going to change this question ID to training components in person. I'm going to throw a display condition on here to say that this training has to have taken place in person. Now, I'm going to copy this, paste it. Now I'm going to change it to be remote. Change around my question ID, make sure that it's saying training components remote. Change my display condition to be remote. So this is fine, but now what I want to do is I want to make sure that we do have training components just as one variable that shows everyone's data. So what I'm going to do is I'm going to create a hidden value with the question ID training components. And here I'm just going to coalesce these 2 answers. Now remember, what the coalesce function does is it will return the first non-null value. So we would expect that one of these questions will always be null and one of them will always have a value. So that works great for us. So I'm going to do coalesce the in-person and the remote. So what this will do is it will give us one answer depending on which one of these questions you answered. And what that will do is make sure that everyone has some value in this training components hidden value. The other really important thing is, since we've named it training components, it now means that this data will be in the same column that this question earlier filled in. So you're not going to see any data changes either. So that is it for our first example. I'm going to throw us back into our presentation. Our next use case is back to work. You know, we've heard from a lot of people that they're very concerned about their employees going back into the office. This is, of course, in a situation where you have reopened, or at least partially reopened. And so then companies or organizations are making the decision themselves about whether it's safe to send their employees back to the office. We've also seen this with a lot of organizations who do home visits, either for healthcare or other purposes. They want to make sure that it's safe to send their staff out into the field. And so our solution is to make these mandatory health screening forms that people can fill out at the beginning of their day. And so again, for these health screening, we're looking at either forms where employees have to fill out a screening form before they can do any of their work for that day. And they actually don't see any part of their application until they've been screened and cleared for work. So if I log in the morning, I do my health screening. If I fail it, I actually don't get access to the rest of my application. And then similarly, if you are doing home visits, you can also create a form, not only so, of course, the user has to clear themselves to go out into the field, but you can also create a screening form where you do a short phone call with the house before you visit them, clear them, make sure that it's safe for you to go there as well. So we're going to go through both of those examples. This first one, again, is just a simple user health screening. So your mobile users need to do home visits, but you want to make sure they're healthy enough to travel and make visits. This could also be if you're just wanting them to return to the office more generally. So you're going to add a health screening form that they have to fill out every day before they begin their work. And again, you do not want to allow the user access to the application if they fail their screening. So here we've actually got, we will be putting this out as a template application. I don't believe it is yet, but this is just a demo app I made. It's called Village Health. It's a very simple application that has tracks households and then a few other health things within here. And here is our COVID-19 workplace screening. So we've got this user check-in, which is the daily screening form for a user. And then we've also got household screenings. So of course, what we're doing right now is the user daily screening. So what I'm going to do here in my application is I am going to add, I'm just going to add a survey. We're only working with user properties here. So I'm going to add a survey type. Sorry. I am going to reopen this one up. Okay. So like I said, I'm going to add a survey type module here. And I'm going to call this, I'm going to call it something kind of big, bold, and annoying. Start here, daily health screening. And then what I'm going to do is I'm going to copy and paste all of the questions from my template application here. I'm going to select all, including hidden values. And I'm just going to do Control C and Control V to paste all of them. So you can see essentially what it is it's asking the time that they are checking in at, and then it's asking about signs or symptoms. So there's a bunch of different symptoms. And then it asks if you've had like respiratory conditions, close contact with someone, if any of your household members have symptoms, if you've been in quarantine or isolation, and if you've done any traveling. Then at the end, it's going to tell you stay home or you're cleared. So now that I've got this here, I need to save two important user properties. One is this user property called high risk. So if you're high risk, we're not going to allow you to go out. If you're low risk, you won't. In this application, we've defined it as you ticking basically 2 danger signs from this. The other thing that we want to save is the date of check-in. Because of course, if you pass your screening today, we still want you to show up tomorrow as not having screened yet for that day. So we are going to save the date of check-in as a user property and also high risk. And now that we've done that, we're going to want to add some display conditions. Remember I said we didn't want the application to really reveal itself to the user until they had passed their daily screening. So what we're going to do is we're going to use these 2 user properties and we're going to create some module level display conditions. So first I'm going to go to my household visit and I'm going to say #user date of check-in equals today and user high risk equals no. Which is basically saying I checked in today and I was not high risk. So I'm going to save that. Similarly for this other module, I'm just going to put the exact same display condition. And then down here in surveys, there's a couple things I'm going to want to do. First of all, I am going to want to, hang on. I'm going to want to go into menu mode. So I just wanted to show that form, not the module. There's no need for my users to have to double click on that. So I'm going to come here to the module and I'm going to set it to display only the form. And then on this, I'm just going to have one display condition that says user date of check-in equals today. Or sorry, does not equal today. So once you fill this form out once in the day, you're not going to see it again. And I will just go through very, very quickly and show you guys what this looks like. So let me log in as a real user, who I don't believe I filled this form out for today. So you can see when I go in initially, all I see is the start here daily screening. If I wanted to do anything else, I would be blocked from it. So I'm going to set my time in. Have I had a fever? No. I'm going to go through, this is basically a grid of a bunch of different symptoms, and I'm just going to check no to all of them. You, of course, can, I know that not every organization cares about this many symptoms. You can always adjust this from the template that we've created. Have we had a respiratory condition? We're going to say no. Close contact, no. No household members with symptoms. Have you been in quarantine or isolation? No. Have we traveled? Are you wearing a mask? Yes. And then my recorded temperature. I think that's a normal temperature. And then you can see here, you're cleared, proceed to work as normal. And that's what we want to see. So I would then know that I could start, screening other households, go about my business, go into the office, whatever. And now you can see as we come back here, we're not seeing the daily screening form anymore because we've already filled that out once. And we are seeing the two modules that have our actual forms in them. So that's a way that you can create an employee health screening. Now, the next example that I'll go through relatively quickly is this pre-visit screening. And so it's a really similar concept to what we just did, except that it's basically now screening the houses. So your mobile workers need to do home visits, but first they want to make sure that the houses they go to are safe. So we're going to add in this home screening form. It's basically a phone form where they would call this house before visiting and make sure that that house is cleared. This will prompt the user to avoid a home visit and instead do a virtual visit if the home fails its screening. So we're going to go back into this same application. And you can see here we have our monthly household visit. We're going to add one follow-up form here, and this is going to be the screening form. And if we come to our template application, it's this household screening pre-visit screening. This pre-visit screening looks very, very similar to kind of the daily screening we just did. We're asking more or less the same questions, but we've got a shorter list of symptoms. And then at the very end, you can see that it tells you when to visit with precautions, when not to visit. So I've got this, and I'm going to call it the home screening form. And then similar to what we did before, I am just going to copy and paste all of the questions here, including hidden values. Oops. And paste them into this new form. Save it. And then the big things that we are working with here, kind of the case properties that matter to us, is this one called clearance to visit that basically says, are you cleared to visit this house, yes or no? And then I believe we also have a date question here. Yeah, date of screening, which is also going to tell us the date that we did. So, and again, I mean, you have to screen these people on the same day that you're going to visit them. So this isn't something that I can screen you yesterday and I can go today. It needs to be same day screening. So the first thing we're going to do is save the date, and then we're going to save clearance to visit. And in the same way that we put a bunch of module display conditions on before, what we're now going to do is we're going to create form display conditions, again, based off of date of screening and clearance to visit. And what this is going to do is when I go in and I select a household, it's going to show me the home screening form. Once I complete that, then I'll be able to see these other forms for them. So we're going to say clearance to visit equals yes, and date of screening equals today. And this is going to be the same display condition that we want to throw on to all of the other forms in this. So I'm going to do that really quickly, just I think so you guys can see it, because I do think it's a relatively powerful thing to see how that can you know, really change the view that your user is seeing. Now, again, you know, we've built these pretty prescriptively that if you fail your screening, we really don't let you see the application. For you all, like maybe it's the case that if someone fails their screening, you still want them to see some forms, especially some that might allow them to do some virtual or remote visits. So you certainly do not have to be as prescriptive as we are being. It's just, you know, an option, and you can always customize how strict or not strict you'd like to be. Then on our home screening form, again, we just want to say that date of screening is not equal to today, which is just going to make sure that once we fill out this form for one household, you know, the specific household and this day, we're not going to have to do this again. And so I will, again, just really quickly go through and show you guys what it looks like when we clear a household. So I'm going to go into household visit and choose Arjun. You can see all I'm seeing right now is home screening. I'm going to say I spoke with Arjun. And then it's going to ask, did Arjun report anyone had symptoms? I'm going to go through pretty quickly and just say no to all of this. And then you can see it tells me this household is safe to visit with PPE. So it's giving me some customized guidance, asks if I have any other comments. I don't. I'm going to press submit, wait for this to process. And then once I press submit, you should see when I go back in to my household visit and I select Arjun, oops. Now you see that I've got all of the options of those forms there. So again, these are ways that you can build in some screenings into your form, and that you can actually make sure that people are not, you know, not doing work that they shouldn't be doing. Make sure that everyone's safe. Make sure that you're giving tailored guidance based on where someone is going and based on the exact situation that they're about to get themselves into. So at this point, actually, I'm going to toss it over to Jordan, who is going to talk about our home-based care application. So Jordan, I'll stop sharing here if you want to take on over.
Great, let me take over the screen share. And if you could confirm that you can see the presentation again.
Yep, it's perfect.
Thank you. Hi, everyone. Thanks for joining today. I'm going to talk about another use case in which it may be useful to adapt your application in light of COVID-19. As the pandemic has progressed, we've seen that for a variety of reasons, whether it be that health facilities are at critical capacity, or that symptoms of COVID-19 aren't as severe as initially anticipated, that many suspected or confirmed cases of COVID-19 don't always need to be treated in a formal health facility. And oftentimes they're best suited by sheltering in place under the supervision of a family member, a member of the broader community, who's kind of being supported in the background by a CHW. And with that in mind, Damagi teamed up with Medic Mobile, which is another digital health organization, to develop a new template application that's available to be adapted and downloaded for free on our COVID-19 library. They can be used as either a standalone application or a module within a pre-existing application that helps to facilitate this home-based care. So the application was designed with the main perceived user to be a CHW or a CHW supervisor. And in the context of the application, which I'll show you shortly, the assumption is that the CHW is working with a member of the community to facilitate the care that's necessary while a patient is at home sheltering in place for COVID-19. So the CHW is the primary data enterer, but we've also designed the application so that it includes content for both the beneficiary, so the person who's receiving care, and that caretaker. And we've built in educational modules under the understanding that this is new to those caretakers. It's new to CHWs, and it's important that we're pushing that educational down to the frontline level. So the application was designed to digitize workflows described by the core group in their reference guide for home-based care for COVID-19. It includes symptom screening workflows. It helps walk the CHW through an assessment of the patient's home environment to see if they are a good candidate for home-based care. Takes into account their home environment, the symptoms that they're experiencing, any underlying conditions that they might have. And if they are a good candidate for home-based care, the application facilitates follow-up so that the CHW is regularly checking in with that beneficiary and whomever is providing that care at home. The app helps to record symptom progression over time, and if need be, helps the CHW facilitate referrals to either a more formal health setting for more urgent treatment or to a laboratory for further testing. And finally, as I alluded to before, the app contains several educational modules that are designed either for the CHW to go through on their own or for the CHW to use as they facilitate a conversation between themselves and the patient or the community member who's providing care. And it covers everything from basic information on COVID-19 to more targeted content for those community members so that they can understand best practice on how to provide care while simultaneously keeping themselves safe. As I mentioned, the app is designed such that it could be a standalone solution, but in the context that your CHWs are already conducting household visits, already conducting COVID-19 services, it's designed so that it could easily be integrated into a pre-existing application to help facilitate this specific workflow and ensure that COVID patients are receiving the care that they need. So rather than just talking about it, I'm gonna jump into a demo. What you see in front of you now is the classic CommCare home screen. And when I enter the application, I can see the home page for home-based care. As I mentioned, there are both care provision and educational modules. I'll start by demonstrating the process of registering a confirmed COVID-19 case. As Aaron showed before, there are different workflows that are necessary, whether visits are being conducted in person or remote, and this application takes that into account. If the meeting is happening in person, it immediately recommends that the CHW, or rather reminds the CHW that it's important that they maintain a safe distance between themselves and the patient, and that if possible, they wear PPE. You begin by registering the patient. As you may have seen by the case list before, I'm on a bit of a President's test cases kick. Patients can either be registered as lab confirmed or suspected, but you could imagine a world in which you already have these patients registered, and rather than going through this registration process where I'm entering a lot of this key information that may be collected right when you are first registering a patient, you're skipping over this and going right to the component where you're going into the symptom screening, which I'll get to shortly. I'll just continue to enter that basic information. And then I have the opportunity to enter this patient's initial positive testing details. And the application brings up that note because I've already said that they are lab confirmed. For the sake of the demo, I will say that I will not enter those details, nor will I refer this patient for further testing. But if I were to answer yes to either of those questions, the application would walk me through the test entry and test referral workflow. Now we go into a symptom screening. The first question that is asked is if the patient is experiencing any critical symptoms. If they are, the app immediately helps to facilitate that referral to the health facility for more urgent care. And then the workflow would end. So for the sake of the demo, we'll go a little bit further. Enter that the patient is experiencing fever and dry cough, but no other symptoms. And again, this content is based off of the guidelines put out by the core group, but is totally adaptable. So once you download it to your project space, you can make it your own. And we assume that people will download this and then adapt it to their local protocol. Next, it asks about underlying conditions. Based on the core group guidelines, if any of these underlying conditions are being experienced by a patient, they're not a good candidate for home-based care. So if I were to answer yes to this, again, it would walk me through that referral workflow. For the sake of the demo, I will say no. And then we're brought into the residential setting and caregiver assessment. Based on my answers to this assessment, I get different educational material shown to me as the CHW that I can share with the care provider. So if I were to say that there is a safe isolation place, the app merely reminds me that the patient should keep a distance of 2 meters between themselves and other household members. Whereas if it's noted that there's no safe isolation place, I get a lot more information that I can share with that beneficiary. It goes through a few other questions, asking how safe it will be for me to for the caregiver or the beneficiary to maintain distance between themselves and others. And finally, asks if there is a caregiver within the home or the community who is well positioned to provide care. If I answer yes to this, I'm able to enter that caregiver's information with the assumption that as the workflow progresses, it's likely that I will be following up with this individual over time to check on the progression of the patient's treatment. So then I enter their care information, and next time that I check on this patient, I'll be able to see that and immediately reach out to that care provider along with the beneficiary. The application now provides me with next steps based on the form that I've already filled out. So in this context, it lets me know that this is a good candidate for home-based care, and I need to follow up with them over the next 14 days. It tells me what I'll be following up on. It tells me that I can follow up with this patient in the home-based care module and the follow-up form. And then it lets me know that as an immediate next step, I should review the caretaker educational material with the caretaker, Eleanor, to make sure that they understand what it takes to keep a COVID-19 patient safe. And now we can see that Franklin Roosevelt, along with the other presidents, are on our case list. Quickly, I'll show you a little bit of that educational material, as this would be the next step in the workflow. I'd go to that HBC for caretakers form, and at this point, the assumption is that the CHW would walk through this material with the caregiver. It welcomes them to the educational module, lets them know what will be covered, provides them with a brief overview of COVID-19, shares a bit about the symptoms, the risks, and I won't go through this in too much detail. Gives a bit of information on how to alleviate symptoms, how to take care of someone, how to sanitize the home, how to keep everything from laundry and food safe, some information on wearing masks and mask safety, how to wash hands, and additional best practices and responsibilities that the caretaker is taking on. Then the application goes into an assessment that the CHW can go through with the caretaker to make sure that they've digested that material. It asks questions, and if the caretaker gets the answer wrong, it doesn't let them continue. It gives them the right answer, so it's not that hard to move on. But the assumption would be that the caretaker would have to get this correctly before moving on. And I'll end that for now, but the assessment goes on. I want to share a little bit about the follow-up workflow as well. But before I do, as you can see, there are a few other educational modules, both for CHWs and for the community at large. So going back to this case list, you can see that I've already registered suspected and confirmed cases for COVID-19. I'll go through now a follow-up visit that I'd perform with a confirmed case. As you can see, this person, while they had their symptoms begin weeks ago, and their latest test result is negative. So we'll go through the workflow of ending home-based care now. We'll go into the HBC follow-up form, home-based care follow-up, and again, it asks whether this meeting is happening in person or remote, provides that same guidance, the importance of wearing PPE, gives us a brief summary of this patient's test results, when they began experiencing symptoms, their case status, when they began experiencing or receiving home-based care, asks about whether they're alive or deceased, and it allows you to enter any new test results that are available. Previously, I had entered a referral for testing. So as you can see, I'll enter a negative test. Once I enter those test results, the app reminds me that a referral had already been issued, and if I want to close that up, I can go to the referral follow-up form and do so, and I'll do that once I submit the form. Since this is Thomas's second negative test, I'll note that I do not want to refer them for additional testing, that they are not experiencing any critical symptoms, that they aren't experiencing any symptoms at all. However, if I were to note that they were experiencing a symptom that they would before, I would again have the opportunity to refer the patient for treatment if the symptoms had become worse, and that would be a judgment call on behalf of the CHW. As you can see, Thomas is now eligible to end home-based care, and these are the 3 reasons based on the core group's guidelines that one can end home-based care. Because it's been 15 days since their COVID-19 symptoms have emerged, it's been 15 days since they first received a positive test, and because they have now received 2 negative tests in a row. So with that in mind, I will mark Thomas as having completed the regimen of home-based care. As you can see, Thomas is now happy as a clam, having gone through this process, and is ready to maybe even get back to work and fill out one of those forms that Aaron showed us previously. Really quickly, I'll go through that referral management module. As you can see, Thomas's referral for testing is still here, and this is very basic. The idea is that it can either be used as a system for CHWs to track referrals that they've issued, or if CommCare is deployed both at the community and facility or lab level, you could kind of have a 2-way referral system, but that's a little bit more sophisticated for another time, and the template app is designed to really meet either use case. I'll go to referral follow-up. It reminds me that Thomas was referred to Lab A on September 30th for testing, asked if the patient had received the services that they were referred for, when they received those services, and then any general comments. So here I'll note, tests came back negative. That's exciting. So I'll add an exclamation mark. And then when I submit that form, you can see that the referral no longer appears. So yeah, that is the home-based care application. It's a taste of what you can do to kind of assist home-based care workflows. And like I said, is available as either a standalone solution or to be integrated within pre-existing applications. And at that, I will hand it back to Aaron to finish up the presentation.
Thank you, Jordan. Sorry, just getting on the right slide here. So once again, let me just wrap up. We have some final thoughts to share with you, just kind of a summary of the things that Jordan and I have presented, but just some things to keep in mind. First of all, of course, flexibility matters. So your application needs to adapt to fit the current needs of your programming. So if you are closing and reopening, your app needs to be able to collect that. If you are doing in-person and remote activities, your app needs to be able to collect that. And like I said, you know, it's going to be like this for a long while yet. So it's not good enough for us to say, oh, we'll collect data in some worse way. We really need our apps to help us here. Version control. So when you are making changes to your applications, and rolling them out, please remember you need to make sure that all users update their applications and are using the same version. There is the app status report that you can look at on CommCare HQ to make sure they are all doing that, but please, that is a really critical part of rolling out app changes, and you will have data issues if people are using different versions of the app. Remember, depending on the changes that you're making, if you're making any sort of substantial change, you're going to need to provide some sort of training to your users, whether or not that's, you know, virtual, maybe a phone call, something like that. But you just need to make sure that any big changes to your application, you've actually walked your users through what they mean and what sort of implications they have. Don't assume that you can just push a new version and everything will be great. It won't. Planning workflows. Make sure that you understand how data is going to be collected as you start planning these workflows. Is someone going to be on the phone and entering into the application? Are they going to be in person, but 6 to 10 feet away? Are they going to be wearing PPE? What are the things that might affect the way that this data gets entered in? Super, super importantly, we want to determine if you need to maintain your case or your form data. And if you do that, of course, we need to make sure that all of the columns in either your case or form data exports stay consistent. So do you need to be maintaining question IDs for form data exports? Are you using the same sort of, the same case property names? So this kind of feeds into the stable properties. Make sure that you are maintaining question IDs and case property names to ensure that you're not breaking any exports. If you're not sure how that's going to look, make the changes in your app, do not release them, put in some test data, take an export and see how that looks. It's much better for you to play around with it, test it before you release it. Even if you do something wrong, you can always revert it to the last stable build, but you do want to test that. Maintaining that data integrity is key. And then lastly, just remember, your users are going to have concerns just like you do. All of us are living through a really unprecedented and challenging time. Anyone who is a frontline worker, I think, has even extra stress here. It's stressful for everyone, but especially your frontline workers. So make sure that you support them. Make sure that any questions they have, you're getting to, and just let them know how appreciative you are of them continuing to work in these ever-changing environments.